Research shows that African Americans suffer disproportionately from most diseases and have a shorter life expectancy. Some of the health disparities experienced by African American men include a 50% higher cancer mortality rate than white men. They are nearly twice as likely to die of a stroke than whites, 2 times as likely to have diabetes than whites, and nearly 6 times as likely to die of AIDS than their white counterparts. Eliminating disparities in health outcomes is an important issue and has become a top priority at the state and national levels. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for Healthy Connections. The goal of the Black Men's Health Alliance is to increase health literacy, inspire healthier diet and exercise habits, get more men connected to competent primary care, and remove the stigma of self-care. Clarence Reynolds is here to introduce us to this brand new nonprofit and what it can do for our community. This is such fun having you here because you're a journalist, you're an entrepreneur, and now this new venture. Why?
This is my calling. I mean, I have gotten to the point in life where I was looking for ways to understand the changes going on in my own body as I age, what's aging, what's abnormal, and trying to navigate that as so many of us do. And what I realize is that for me and for so many men like me, we're trying to figure out, how do we age gracefully? How do we live our lives? And what are the tools that are available? When I went to look for tools that I could use, there were none. There was no one taking a holistic approach to understanding how wellness affects our lives and how important it is. And particularly for Black men, once you do the research and you look at the numbers, we have the lowest life expectancy. We are dying from preventable diseases, and it is something that really is urgent, that we really elevate wellness in our agenda and what's important to us.
So what makes this different other than your target is African American men? Let's talk about the psychological part of this. I'm not going to the doctor, I'll be okay, I'll take some herbs, I'm going to pray it away. You know, how do you deal with that piece?
There are a lot of men, Black men particularly, who have that old school, it's got to be red, swollen, and about to fall off before I'm going to go to the doctor.
Yes, that piece.
And those are part of, that's one of the things that we want to address. It's myself and Dr. Brian Sykes, our co-founder. We wanted to create a community because we think that community is a very important asset in change, in improving health outcomes particularly. And we wanted to make sure that we were doing it in a holistic way. So we have 4 pillars that we concentrate on, that we really want men to think about and to improve. And that is physical wellness, mental health, fitness, and nutrition.
Let's talk about the mental health piece. You know, it's easy to say, here's a list of foods, here's the way to change your diet, here's a way to introduce healthier things. But when we start talking about this and the connection, sometimes that can be a little vulnerable. Even if you're not an African American man, it's a vulnerable place to be. How do you handle that piece?
You know, it's not only the vulnerabilities, it's that we are dealing with layers. We have top line, typical microaggressions, overt racism, covert racisms, and then the systemic the surface things that are happening with employment, media portrayals, and the mental health around watching what we watched in 2020, a public execution in this country. And those kinds of things doctors are calling weathering, meaning that they are acting on our psyche. They are impacting things in ways we don't know, in our health, in ways that we don't really realize. So what we want to do is to make sure that we're holistic. We are talking to and with Black men about those things, that all of the layers, and peeling them back one at a time through those 4 pillars and trying to get them to connect the dots, trying to make sure that they have the tools to connect the dots.
So let's talk about the nutrition piece, which I'm assuming would be one of the easiest ones to tackle, that and the physical health. What are some of the ways you get men started making those shifts? And you're shaking your head. So.
It's actually one of the hardest.
Really?
Yeah.
What's the easiest?
I think the easiest is probably, I mean, none of them are easy. I think one of the things that we can do as Black men is to do the simple things, like 1 annual physical a year can save your life. We've lost high-profile men recently to things like prostate cancer, which is one of the most treatable diseases around, and Black men die 47% more than our white counterparts.
That's a big number.
It's a big number. And we've had Dexter King, Joe Madison, the Black Eagle, both of whom men of means, who have died from prostate cancer. And a lot of men walk around with the symptoms. And I have a friend who walked around with the symptoms and played golf with doctors for years. And it decimated his family.
So what can people who care about the African American men in their lives do to support what you're doing? Because sometimes you need a little nudge from someone who really cares.
Yeah, it needs a nudge, but we think it not just the nudge, because Black women take good care of us. We know that, but it's also we have to take charge of our own health. As I say, it is not our fault, but it's our responsibility. We have to really start to think and elevate our health in our lives. And so that's why we think community is one of the big keys, that with the Black Men's Health Alliance, you're going to be part of a community who's doing the same thing you're doing. They may be at different stages, but they're doing the same thing. They have the same focus, and they're elevating wellness as a priority in their lives. And that's all we really want you to do, is to help improve health outcomes.
And we have information on how to find out more about what you're doing. Thank you, Clarence, because for some people, this might seem like, how do I eat the whole elephant? But you're saying 1 bite at a time.
1 bite at a time, and with other people who are doing the same thing.
Okay, thank you for everything that you do, not only as a journalist and an entrepreneur, but just because you care.
I do, yeah, thank you.
We'll be back right after this. Dr. Abe Woods is here to continue our discussion on Black men's health and why it's important. Doctor, we have done this conversation almost 10 years ago.
Wow.
About Black men's health.
Yes.
What's changed? Has anything changed?
You know, that is a very good question, because you like to say things have changed. 10 years ago when we were here, we were saying about the death rate and incidence of prostate cancer was going down. But since that time, we've come through the pandemic, and things are changing in an interesting way. And it's not just related to just Black men's health, but we got to look at the political arena of how do we determine when a country needs to provide health care for its citizens.
Oh, that's a whole different discussion. Yeah, absolutely. So, kind of piggybacking off what we heard from Clarence about this alliance to create a community for black men to take care of their health. What's been your experience with your patients? And you're a urologist, so first let's tell everybody what that is. What is urology?
Urology is actually the medical science of surgery for those that are specifically that does surgery for kidney, bladder, prostate, penises, vaginas, that type of thing. We are the restorers of your urological health and your reproductive health, and we help you to keep your ladies, and we help the ladies to keep their men happy.
Okay. That is the most elegant description of urology I've ever heard. Now let's talk about how difficult it is, or is it difficult, to get African American men to come in and get checked out every year. How do you encourage people to have the exam that can save their lives from one of the most treatable cancers out there?
Well, you know, when we talked years ago, we said one of the platforms that helped the African American men was their lover, the female, and getting that wife or that girlfriend to encourage the male to go to that doctor, making contact with the doctor or a community health group, or participating in something such as the projects that we've had in Orlando for years, such as the Black Men's Health Summit, where men come together and see it's okay to talk about health. It's okay to talk about illnesses, because we grow up under the cliche that men don't cry, men are strong, and therefore when we get illnesses or we get a hurt or a pain, we don't say anything. And usually the problem with this discussion is that most times black men are presenting late. Like we heard the information about Dexter King.
Yes, early 60s.
What was so bothersome is that within 3 years of a diagnosis, and you go like, men really don't die that acutely from prostate cancer. Not in 3 years. What's going on? Did he miss the message? Was there something wrong with the outlay of community? Was there something wrong with his relationship with physicians? Now, when people come to me, a lot of black men may come to me and feel comfortable talking to someone that looks like them, may have the same tone of voice and mannerism as they do, so they can talk openly about those things. That's important. And having a healthcare system where people are sensitive to cultural differences and how they look upon, say, the healthcare provider.
So let's talk about cultural differences. What are some of the biggest ones that you think we should all be more sensitive to?
Well, black men are not really macho, as we say, oh, they don't need anything. We see the image of black men in sports, and we say that's a superior image of what black men are all about. Basketball, football, baseball, those types of things. But to see them in a vulnerability type of situation, such as a medical illness, is something that's very difficult to grasp. I mean, imagine you grow up in your household. Rarely do you see your father crying or making complaints about health issues, or taking a goody powder or taking an aspirin. Rarely do you see us say, oh, my back hurt. We get out there and we work. So the image of what it is to be a man and a black man and what the responsibilities are affects that individual. And sometimes that individual has to know it's okay. But who tells him that? Because when you look at media today, that's not the message that they're getting.
And hopefully this conversation and this show will go a long way toward closing that gap. What would you say to black men who are watching this right now and are saying, yeah, but?
When you say, yeah, but, the statistics are clear. When we see that we're losing our women from breast cancer, and then we're losing our finest men from prostate cancer, diseases that can be treated if they're picked up early on. Early detection and screening really works. And then too, yeah, but changing habits. Because one of the problems that's gotten us into this rut is that we've gotten so used to bad habits, whether it's our diet, our environment, the things that we smoke, the drink, And then we get into issues where mental health has been a big issue in our community, and who helps us to deal with that? So those factors are important. And then one of the things I say to black men listening to this program, we need a health care agenda for all citizens of this country. Because the thing is that most black men are either underinsured or they don't have insurance. And that could be a factor because of the jobs cutting, laying off, and not paying full benefits. And so when you have poor access to health care, what can you do? We can do screenings at churches. We can go into the community and do a lot of education, sit in a barber shop all day talking. But once we find positive takers, you got a positive exam, you have a positive urine exam, because I do DNA in the office. All these things are positive, but then again, who pays for that? Who writes the check?
So we're talking about a systemic
We
cure
need
and approach.
Right. We need our country to focus on, do we want healthy Americans? Not just black men, but healthy Americans.
Dr. Woods, thank you for doing your part to keep the African American men in our community healthy.
Oh, you're welcome, and thank you for all that you do, and also for this initiative to encourage black men to participate in the process of acquiring good health.
And that is the last word. We will be back right after this. When any segment of the community has disproportionately higher rates of death and illness, the entire community suffers. We've heard some shocking numbers about black men's health, but hopefully this show has gone a long way toward ensuring that that section of our community will make healthier connections. I'm Annetta Wilson. Thanks for joining us.